Hey everybody, it's Michael Johnson from Meta Johnson Associates with a quick note today on medications in people living with dementia. If you have a family member who is living in an assisted living facility and has dementia, one of the things that we come across a lot is that they may be experiencing depression or anxiety. And sometimes when a provider sees that, they will prescribe a as needed, also known as PRN medication. The thing about PRN medications in assisted living facilities is that the patient has to request that medication. So if someone's living with dementia, it can be hard for them to know that they should do that. Other PRN medications, like let's say Tylenol or something, are a little bit easy to administer because the staff can identify when the person is maybe grimacing in pain. But mental health issues can often get overlooked. So if you have a loved one in a facility that has a PRN mental health medication, a recommendation is to consider it having scheduled, which means it's given a certain time of day, a certain number of times of day as well. So take that into consideration. If you're not sure if they're getting the medication and you have the healthcare power of attorney for your loved one, ask to see the MAR, the Medication Administration Record. This helps you see every single day, multiple times a day, when a medication was given or not given. So that helps you see, is mom asking for medications? Are they giving it to her? This is also helpful. I guess I should say rather, one difficulty with that is I've had some facilities before actually push back on our ability to view the MAR, claiming a privacy issue, that because it includes providers' initials, their privacy is violated if someone looks at it. That's wrong. The patient and their proxy has a right to access the medical record. If you come across that issue, ask to speak to the executive director. The second topic for people living with dementia and medications is if your loved one is at home and has a home care provider. The caregivers and the home care companies are under strict regulations to make sure that they're giving appropriate medication. So your mom may be visiting her primary care doctor and they may say, you've complained about pain a little bit, so just take some Tylenol and look at the bottle and see how often you should take it. A home care provider can't go by the directions on the back of a bottle. They're going to need an actual order from the doctor saying how many times a day to give the medication. And again, the same goes for home care as assisted living facility. PRN mental health medications are better to actually schedule because it can be difficult for the person living with dementia to know to request the medication. Hope those are helpful tips. Have a good day.